Hello, I am Dr. Harish Kumar. I am a consultant pediatrician at Aster CMI Hospital, Hebbard. Generally, parents of any child worry when they have to visit a doctor. The routine visits as per the vaccination schedule has to be done anyway, and the routine visits as advised by the primary pediatrician should be done. Apart from that, whenever there is some illnesses, common illnesses that come with symptoms of fever, cold, cough, vomiting, diarrhea, stomach pain, earache, rashes, these are all the common symptoms that parents encounter in a child. And when these symptoms are especially progressive or profound or prolonged, then you should visit a doctor, a primary pediatrician nearby to your place. Avoid doing self-medication, at least in terms of antibiotics. But you can always give a paracetamol kind of fever medicines which has been advised by the pediatrician if you know the dose, or if the pediatrician has recently advised you what dose to be given whenever there is fever. What is fever? Fever is any temperature above 100 degrees Fahrenheit. Avoid giving paracetamol and other fever medications when the fever is not really more than 100 Fahrenheit. And children usually do not deceive. If they have a problem, they do show up some symptoms. Maybe the symptoms may not be classical like an adult who are vocal and tell the problem. Children do not tell the problem, but they express the symptoms in their unique way, which may be subtle and may not be picked up by many of the common people. But it is very important, and they do present. In these kind of symptoms, you please bring the patient to the primary pediatricians nearby so that it is not delayed. Not just the symptom of the illness, but what is the activity of the child, how conscious, how playful the child is. That is more important than what symptom child has. If the child is very dull, lethargic, and you have to also look at the oral intake. If the oral intake is very poor, child is refusing to eat anything, especially refusing to even take liquids, that is something worrisome. You have to immediately consult the pediatrician so that it is not delayed. Most parents wonder when they have to take their children to pediatrician for a checkup. General routine health checkup as well as vaccination visits have to be followed as instructed by the pediatrician who is regularly seeing the child. But when there is some symptom, when there is some problem, child encounters some symptoms like usual common illnesses come with the symptoms of fever, cold, cough, vomiting, loose stools, stomach pain, diarrhea, earaches, rashes, and so on. So these kind of symptoms, you have to take the child to a pediatrician. More than the symptom, the intensity and other things have to be looked into. Fever more than 100 degrees Fahrenheit is significant to give a paracetamol and take the child to the pediatrician. Along with that, looking at the activity of the child, how well, how conscious, how playful the child is, that is more important. If the child is becoming dull, less playful, or prefers to always sleep and doesn't take orally. Oral intake is very important. If the child is taking orally and playing, even if there is some symptom, the parent can wait for a day or two, give whatever primary medications the doctor must have advised them, and wait for a day or two. If the child is becoming dull, not taking anything orally, the oral intake of liquid is more important than the food, and the child doesn't show interest in anything and symptoms are progressive, then this is an alarming symptom and you have to take the child immediately to a pediatrician. So children do not deceive us in terms of symptom. If at all there is a problem, they do show us the symptom, but they do not vocally tell the problem like an adult. They show it in a very subtle way or in their own way, which has to be picked up. That's all.